I'm Cindy Hayes, Beacon Medical Group's Vice President of Operations. I just wanted to touch base with you today to talk to you for a few minutes about an article that I recently read titled, "When We Hit the Wall." And understanding that we are in the middle of a pandemic, we are in what we would consider wave 2, and we are all at that point of what I would consider hitting the wall, or definitely hitting home for me. The author shared that years ago he attended a concert where the pianist was the star of the show. He was playing the piano flawlessly. Then he stopped suddenly and he said, "I can't do this anymore. I can't play another note. I'm just exhausted." Well, we all know what that kind of fatigue looks like. It's been building day to day, week to week, month to month. The first wave, the second wave, who knows anymore how long it's going to go on. It's dulled our minds and our bodies and our spirits. It's just unreal. Who would have thought a year ago that we would be walking around this year wearing masks, circles and arrows on the floor to know how far to stand away from one another, the inability to give a hug when we want to give a hug. What we would assume is that there was some sort of a natural disaster, right? A natural disaster, the aftermath of a catastrophe. Unbelievable. We would have never expected this. So fatigue has no boundaries. It happens to everyone and at every level and in every organization. No one's immune. We oftentimes feel discouraged. Why are we doing this? Well, we have to make sure that we have purpose. And our purpose when we're in the healthcare field is that we truly care. We went into healthcare to give our time, our talent, and our treasures. So what happens when you have purpose is you find some extra energy. You get the enthusiasm when you're just exhausted. You somehow manage to keep going forward. What we need to do is look ahead and say, what do we want a year from now to look like, and manage to get through this in the current state. So if you start asking yourselves that and what we want to accomplish and how we want things to look a year from now, you can get through it. Who would have thought we could have set up a telehealth platform in less than 2 weeks and had all of our providers on it? We wouldn't have had the pandemic chasing us and the threat of having to shut down. We wouldn't have done it. Standing up a hotline, getting a phone number, having technology, processes, people ready in less than 24 hours, amazing. So I like to take advantage of a good crisis, but you do get tired after the crisis continues. What we would have considered impossible before this, now it's sort of like that's just an expectation. Most recently, we have just been bombarded with patients that are needing to come through the drive-thrus for screening tests. The high numbers that we thought were 100 at our Main Street location, we've doubled them. Yesterday, it was 241 patients that came through the Main Street drive-thru for swabs. So while we thought our maximum capacity was 100, we're doing 240. I have a trailer site at Lippert, at the employer sites, that the person there thought that 50 was the max that they could ever do, and then they did 61 on Monday. We all managed to push and managed to get through. Certainly we ask for more help and we raise our hands, but we always manage. And I think one of the things that we do the best is we make sure that we have hope and humor. So for those of you that know me, I like to have fun. And one of the things that I have enjoyed most are some of the stories that the providers have shared about patients when they don't expect you to come onto the telehealth platform when you do. They haven't been inappropriate, but there's been some fun stories of patients coming in, maybe not realizing that the doctor was on the screen yet or the nurse practitioner. Pretty entertaining. We've had the swabbing sites where people are getting in the line. I must have had to also take the time to get their pontoon out that day. And so they came through the line with a trailer and a pontoon on the back. We've had such long lines at Elkhart General because of just the magnitude of people that need to come through. I guess the key is no matter what our role is, we're the daughter, the parent, a recruiter, a registrar, giving direct patient care. We have to ask ourselves, are we doing this for ourselves or for others? And I'm pretty sure we're all doing it for others. And we feel good about it for the most part if we can rise above the fatigue. But we don't want to hit the wall. We have to make sure that we take care of ourselves. And we do have the employee assistance program that's really very useful. And we would really encourage people to use that. It's discreet. They give you good advice, and they give you some ideas on how to take care of yourself. So my message today is try to avoid the wall. Please continue to volunteer. We very much appreciate you. And I thank you for supporting Beacon and our community.